Local productions seen on Delta College Public Media are made possible with support from viewers like you. Thank you.
Well, good evening, everyone. I'm Mike Redford, and this is the follow-up. Coming up on tonight's show, major public health concerns fueled in large part by the government shutdown. The political power struggle has stopped the flow of food assistance to those most in need. Rising health care costs impacting all of us is also at the center of this major debate. Plus, the anti-vax movement is creating mistrust about many of our tried and true vaccines. Could it result in a rebound of highly preventable diseases? Two people who work in the front lines of these important public health issues will join us tonight. But first, we'd like to hear from you to help drive the conversation here on the show. You can do that in a variety of ways via social media on Facebook. You can dial into our follow-up hotline to voice your opinion or suggest future show topics. And if you'd like to watch any of our past shows this season, you can just log on to deltapublicmedia.org. Our guests tonight in studio, two good friends, Joel Strasz, he is the Bay County Public Health Officer, and Chris Girard, the mayor of the fine city of Bay City. He's also a member of the SNAP Coalition, which we're going to spend a lot of time on tonight. Lots of significant health-related issues to talk about tonight. Going to start with the pause on the SNAP benefits. Because of the government shutdown, SNAP stands for Supplemental Nutrition Assistance Program. So I'm going to show the viewers a graphic, and you as well. More than 1 million people in Michigan rely on this assistance, including tens of thousands in mid-Michigan. And Chris, you are part of the food insecurity community response to this that's just basically days old, your coalition. This is kind of an emergency. So who's part of this response team, and what are you doing?
Yeah, it really started when we found out that the SNAP benefits were going to be cut off. So it started with a response with the United Way of Bay County, the Bay Area Community Foundation, myself. We got on a phone call and said, we need to do something. What kind of immediate response could we take? Along with that coalition, we brought in the Bay Area Chamber of Commerce. We brought in folks from the school district and from the county government, and the response about a coordinated effort about how do we collect food and then how we distribute food, along with financial resources to distribute all those folks who have those kind of needs.
Yeah, and there are 16,000 recipients on SNAP in Bay County. In the graphic that we showed, how many of those are kids?
So we estimate about 6,500 of those are children. So that's a pretty big impact, in our community.
Right. And Joel, as the public health officer in the county, kind of what's your role? Have you been part of this, or ancillary a little bit here?
Yeah, so we were consulted early on. We administrate the WIC program, the Women, Infant, and Children's Program, which is a supplemental nutrition program. We've got about 2,000 kids or about 2,000 people on WIC. Includes moms and kids, babies. And it's a variety of different things. It goes up to the age of 5. And it's kind of limited in comparison to the other SNAP benefits. It's mostly geared towards nutritional development and things like that. But there are a fair number of people, that like about 2,000, that are actively participating in WIC. In a given month, we see anywhere from $50,000 to $70,000 worth of economic activity that's generated from those benefits. But these are people that are truly in need, that truly need food, nutritious food. In addition to that, what we're seeing as well is that we've got a pretty substantial amount of infants and toddlers that are on formula. Mm-hmm. And I mentioned before is 50,000. That's actually more towards the formula. It's about $125,000, $175,000 per month. But $70,000 worth of formula. A fair amount of kids that are on that, and they could lose those benefits, and those families are really going to struggle if those benefits are cut off.
Absolutely. And Chris, we were talking before, Joel touched on the economic impact. It's vast.
Well, yeah, not only, are those individuals impacted, right, without food and having food insecurity, there's about $1.8 million that cycle through every month in our economy that those benefits are being spent through grocery stores, local mom and pop shops. So as these benefits stop, those dollars aren't cycling through our economy either.
Right. Sounds like as far as WIC's concerned, you guys were telling me at least the state has been able to come up with some funds to keep them flowing until
Yeah, they've been able
third
to
week
shore
of the month, right?
Yeah, shore up resources until
Okay.
about November 24th. And depending on, with this additional SNAP money, they may be able to utilize that. It's really unclear, especially as of today. At the beginning of today, it looked like the administration in Washington was going to go along with the court order. Then it looked like the president said that they weren't. And now at the end of the day, it looks like they said they're going to do partial. It's really difficult to say.
Yeah, I've heard that up to maybe half. And that's number one, not nearly enough. Plus it takes not just days, but you can't just flip a switch and say, okay, we're going to fund half of that amount. It might take weeks to get that money flowing and get the assistance that they need, right?
Yep.
Yeah. I'm going to, the center of this government shutdown debate, in addition to ending SNAP and some of these other programs we're talking about, centers around whether or not to extend subsidies on the Affordable Care Act, known as Obamacare, which ends at the end of this year. So the high cost of health insurance is the major issue here. So where can people kind of turn for resources, help in the county for affordable and quality health insurance? This is a major. We're all kind of waiting. This is an open enrollment too, and we're all kind of stuck, right?
Yeah. So for those people that qualify for Medicaid, they can go to DHS, they can go to the health department, they can go to even sometimes like the hospital or their local provider to get signed up for that. But there's eligibility requirements for that. And with Affordable Care Act, that really expanded a lot of Medicaid slots. And then on top of that, there is what you had referred to of, the marketplace and some of the subsidized plans there. And that is what the shutdown seems to be most about, whether or not that those subsidies are going to continue or if they're not going to continue. If they're not going to continue, we're going to see a substantial amount of people just get knocked out without insurance. They're either going to have to pay much higher premiums, or they're probably just not going to buy health insurance at all and go it alone. Typically when we see that, we see people avoiding preventative and necessary medical visits. And what we tend to see too is higher medical costs, because what could have been prevented or what could have been seen at the time before it became a crisis becomes a crisis, and then you see like much more intense medical care and much more intense medical costs as a result.
So Chris, is this coalition getting into some of that? Are you guys strictly on sort of SNAP, WIC, Head Start?
Yeah, we're strictly dealing with the emergency right now. We don't know, right, the scenarios of how this plays out. So we're just trying to address the emergency scenarios, try to keep people afloat until they do figure it out. Hopefully it's resolved shortly. Like I said, there's an emergency fund now at the Bay Area Community Foundation that's been established so people can donate directly there. And then the United Way of Bay County is collecting food resources every day.
Right.
And then there's 17 pantries that are connected to this initiative. And so they're just trying to keep those things stocked. I know at the Community Foundation, they're buying food on a bulk level, and they're also buying emergency cards to give the folks.
Okay. So what are you asking folks to do? Those that are part of this SNAP benefit program, those that are in need, do they call the Community Foundation? Do they call the city? Do they call the health department? We have a graphic here that some people can call 211.
Yeah, they're directing people to
sources.
211. Yeah.
Because I'm assuming phones are ringing out the hook. People are asking a lot of questions, trying to get answers. So I'll let you both kind of take that on.
Yeah, 211 is the preferred resource. They can direct where there are pop-up mobile pantries and the 17 pantries. If you want to give, you give to the United Way as far as actual, as I said, donations of food. And the Community Foundation, they have direct links on their website to give monetary donations.
Okay. All right. I know churches, restaurants, I think we're just scratching the surface of people coming out of the woodwork to kind of help. And you pray this thing ends sooner, because it's just ridiculous in addition to it's just horrific, right?
Yeah.
You're a government official. I mean, can you believe we're dealing with this right now?
Well, I still have a hard time believing, like, when I grew up, we never had food pantries, we never really had hunger this bad. And so it's always, in the last 10, 15, 20 years, it's always been an issue of consternation for me that we still face hunger in the United States, and especially in Bay County.
Right.
And it really shocks me that we could see 20% of the population here in Bay County, like, really dealing with hunger and food issues.
Right.
That shouldn't happen in 2025.
Yeah, I agree.
Yeah. And Chris, you mentioned the amount of children. Out of the 16,000 in Bay County, 6,500 roughly are children.
Yeah.
And in Bay County and other counties, Saginaw County, Midland County, Genesee County, infant mortality rates are still too high among our lower income families, particularly African American families. This is only going to make the situation worse.
It's just going to exacerbate.
Oh, yeah, absolutely.
Yeah.
So what are you doing in the county in regards to sort of change that trend, change that direction in infant mortality?
Well, one of the things that we've been really making a concentrated effort in the last few years, because we see with our numbers with infant mortality, they kind of come in peaks and valleys. We're nowhere near some of the larger cities. But then again, we have some serious issues with poverty. Mm-hmm. And we tend to see some of the same issues go with that. So number one is we want to engage moms, especially pregnant moms, and people that are seeking to have families early, so that they can get into and get adequate prenatal care. Right. I think that's one of the big things. During the pandemic, in the early stages of the pandemic, 2020, the number of moms that had adequate prenatal care dropped from 90% to about 70%, which is huge. We were able to bring that back up into the higher 80%, but we're not as high as we need to be. We have a lot of work to do, and I think that's part of it. But the other part is what we're trying to do with the Food Coalition is bring the resources to the people that actively need it.
Right.
Because a lot of people don't know where to go to get the resources they need.
That's part of the reason we're doing this show. I want people who are watching to say, here, this is the issue, this is where you can go. Another thing that affects families is affordable housing. You got to make sure they've got some shelter for mom and dad, these little ones. So and there's some movement there, right, Chris?
Yeah, we they just started tearing down the old facility, which was the old YMCA in Bay City, along with the old county market. So that'll be leveled, and there's going to be over 100 housing units by the Bay City Housing Commission being developed. Long-term, up to a couple hundred units in that area.
That's a problem everywhere. We're always looking for affordable housing. It seems like you're making some headway there, so appreciate that. So now I'm going to segue. I need to talk about vaccination rates, because we're speaking to families, young families. They need to get vaccinated for all kinds of things. Vaccination rates seem to be dropping. So what's your sense as to the level of mistrust in our communities around vaccines because of this anti-vax movement? So that's kind of like two questions. What's the level of mistrust, but also what are you seeing in Bay County in terms of vaccination and vaccination rates?
So I'll say this first, is all parents universally want the best for their children. Nobody wants to say like, you're on your own, or
of course,
whatever happens. But especially in the last 10 years, we've seen the vaccination rates drop. We're still in the top 10%, or the top 10% of vaccinated counties in Michigan, but we're not as high as what we used to be. And in some circumstances, we're seeing outbreaks of things that we never really saw in great numbers before. Like this past month, we went through a couple of different chickenpox outbreaks, which, for people my age was just a normal thing, but since the 1990s, it's almost been eradicated. But because a lot of people are hesitant about vaccines, the chance for spread is greater. And with the chance for spread being greater, and you just don't see people exposed to it, the chance for more serious illness is much more greater as well. Now I know there's a couple of different measles outbreaks, pretty significant ones that have occurred, not only in the United States, but in Michigan. And we're keeping an eye on those. And I know it's just a matter of time before we see a measles case here in Bay County as well. But what we want to do and what we've been doing for the last 25 years is we're still providing vaccination opportunities at little or no cost to parents. In fact, if anyone brings their children into the health department, we vaccinate those kids whether or not that they've got insurance, whether or not that they can pay. We don't turn people away for that. And that's important because when we get to discussions about autism and different causes and things like that is, you know, there's been a lot of talk about Tylenol, or does that cause it, or do the vaccines cause it? But there's also a lot of discussion and a lot of studies that indicate that serious illness can have serious developmental effects on children. And that's one of the things that, you know, we didn't have to worry about in the past, but now we're worrying about now.
Because there's been talk that immunizations for what have been vaccine preventable diseases are sort of at record lows. Is that sort of true? And what were preventable diseases could rebound? You mentioned measles, chickenpox, polio. Are we just taking it too far? But is that realistic to say some of these could make a comeback and rebound a little bit?
Oh yeah, definitely. I mean, we did see a few polio cases about 5-6 years ago in New York in certain communities there, and they were all unvaccinated kids. You don't see that in vaccinated kids. And that's the other thing too, is with polio, there's no cure for polio. You know, some people can recover from it,
right,
but essentially, like, there's no treatment for it.
Right.
So, you know, and it's a very serious illness, and we had a discussion last year about the necessity for polio vaccines in one of the communities that we serve. And a lot of people remember the 1950s when, you know, parents were just petrified of their children getting polio, and, you know, the thought of like having to spend your life in an iron lung or disabled was a reality for a lot of people.
So my guess with social media, there's a lot of misinformation out there surrounding vaccines and a lot of health issues in general. Not to get political, but, you know, RFK Jr., who is the President Trump's Health and Human Services Secretary, seems to be fueling some of this anti-vaccination sort of movement with some of the things he's saying. I know he's brought a lot about the food supply. He's got his platform called Making America Healthy Again. Any thoughts on that? You mentioned autism. He seems to think, without any science or any facts to back it up, that autism could be caused by food, it could be environmental, just in general. He's probably not helping the situation,
it's
right?
It's not, and you know, he'll make pronouncements like, oh, I can tell someone's autistic by looking at them. Well, you can't. I mean, autism is a spectrum disorder. There's a variety of different conditions and levels of severity. And the other issue, and this is probably the main issue, is what is the causative element that enables autism or causes autism. And there's not just one thing. There's no smoking gun. It's not that, you know, for a while there we were talking about vaccines, and there were debates about vaccines, and that has pretty much been debunked thoroughly. And then the next talk was about whether or not that Tylenol caused autism. Well, he referred to a study that was done earlier this year, which was a meta-analysis of a bunch of different studies, and they found that about half the studies found there was no correlative effect, and about a little over half found that there were some correlation between Tylenol and autism. But the key important, or the most important element, the key element of that study was, it said pretty specifically that really a lot more study and research needs to be done to establish the causation. And that's the thing, is he's confusing correlation and causation. And that's what confuses people out there.
Right.
Now, it also can be said too that, you know, when they're kind of telling moms and pregnant moms, like, don't take Tylenol, really what those moms should do is consult their provider, their obstetrician, and find out what the best thing. Obviously, you don't want to take too much Tylenol in any circumstance, whether
Sure.
you're pregnant or not. But there's just no specific data that says that taking Tylenol in and of itself is a causation of autism.
Okay. I'll leave that part of the conversation at that. So I'm glad we got to that. So I'm going to swing back to Chris on the community response that we
Yep.
talked about earlier in regards to SNAP benefits and WICs and getting the funding and getting help to people that are losing assistance. It seems to me the Bay Aranac community, I haven't seen any other communities kind of have this emergency response. Do you think like the only one sort of that you've heard of, number one? Number two, is this something that you've done before in response to kind of a community need that needed to be taken care of now?
Yeah, I'm sorry. I believe, we really do have a tight-knit community, and I think
Other than COVID, of course.
yeah,
but
yeah.
Anyway.
Well, I think we did the same thing in response for COVID. We came together, right, and we really tackled it head on. I think when we see a need as a community, we have a lot of folks here that know working together we'll get a better response in these separate little pockets. So the more we work together and create a plan, the more effective we'll be to serve people.
Right. The other thing you mentioned to me earlier, you both sort of talked about the economic impact, which we sort of forget about, right? A little bit huge. You mentioned the fact that we're an agricultural community, and they're part of this equation too, right?
Yeah, people aren't buying, think about it countrywide, people aren't buying produce or healthy things. Like, we have a lot of farmers here, right? And that has an impact directly to our community.
Yeah. So I'm going to go back over to Joel here for a moment. I know you've had this community needs assessment out there, and the question about that, what's new about that? When was the assessment done? Is the assessment done sort of ongoing, evolving, or do you do it annually, biannually? Tell me a little bit about that.
So
and
we-
also, yeah, go ahead.
Yeah, so we work with McLaren Bay Region,
Okay.
and about every 3 years we produce a community health assessment report, and then we look at the findings and put together a plan for community improvement or health improvement in the community. And so it was our 3 years, and so what we decided to do this year was we integrated some new technology that incorporates artificial intelligence, and it helps us put together the report in a much more efficient fashion, a lot more quicker. It used to take us a good 18 months to go through all the data and sift through it. And by that time the data is old and there's new things, and by the time we publish it, it's already out of date, obsolete. So we're able to actually put together a new report this year that we were able to construct in a matter of months. We did a lot of fact checking to make sure, even though it's AI, you still got to do fact checking and make sure that the data is accurate and relevant. And some of the things that we're seeing is that we're a graying population in not only in Bay County but the region. The birth rates are falling too, so that has a lot of ramifications on things, especially economic and towards education. And we've got altogether about 4,000 less kids, from 0 to 18 than we did 20 years ago. That's a pretty substantial amount. But what we're seeing is that with an older population, a lot more chronic disease. And then we've talked about too earlier, like the cannabis laws and things like that, and dealing with a lot of new issues that we really didn't have to deal with in the past. We have seen, the good news is we've seen drinking go down. So binge drinking's gone down. The bad news is that cannabis use is gone up. But in addition to those things, it's just that it affects the way that we plan for our communities. Like, if we've got more seniors, how do we deal with that? How do we take care of those people? How do we take care of the people that are in need? So one of the things that we look at too is housing and the economic situation. And we were pretty surprised by some of the housing numbers and the pockets of need, not only in the city of Bay City, but all around in Bay County and around the region too. Right. So, but there is there's some good news and some hope that we're turning the corner on some diseases, and but we're still struggling with getting people to lead healthy lifestyles, and we all have to pitch in for that, and we all have responsibility for that.
So Chris, in the city as the mayor, you guys know each other, you collaborate, you're collaborating now on this emergency response. When you hear Joel talk about this this needs assessment, health assessment. Do you guys work with that kind of information in the city to do some strategic vision planning at all?
Yeah, absolutely. We take that data in, and I'm sorry, I'm dealing with my own health issue here.
Okay,
but,
we'll get through it.
Yeah.
Got a couple more minutes left. You're going to make it.
Yeah. But I created my own initiative called Healthy Minds, Healthy Bodies, specifically to tackle some of those issues, to get people thinking about movement as we age as a community. How do we get people connected socially? There's a social disconnect as you age too, and to make sure people are engaged in that process. And so last month we did a health walk and a health fair connected to it. So and I know the health department participated.
Well, I think the one thing that an event that we both attended was there was a men's health event. It was called Pancakes and Prostates. And they
catchy.
They did a PSA.
I didn't get an invite on that. Maybe I should have.
Yeah.
But anyway.
You should have. Really good breakfast.
It was.
And they took a PSA test for everybody that was there, and we had, I think, over 35.
Yeah, it was great. Dwayne
participants.
Parker is the director there. Yeah.
But the important thing to me was the amount of men that came out and the discussion like that. It was a 2-hour event that easily could have went to 4 hours because there was a lot of questions and a lot of people seeking knowledge about how to improve their health. So we're going to try to maintain those events and actually have more like a monthly men's health event.
Like that. Well, men, as you know, we're stubborn.
Yeah.
We tend to put things off,
Yeah.
right?
We
So
do.
I'm sure that was part of the message that you may not want to put things off, right?
Absolutely.
All right. Hey, Chris, last word on this community response to the SNAP benefits that we want to leave the viewers with?
Oh, yeah, sure. So if you need assistance, call 211. It gets you directly connected, and they can get you to those pantries or any pop-up markets that are happening in distributions. This Wednesday at the city offices on Marquette, they're doing a pop-up distribution. So it's online. Go to the city government website, and they'll connect you there. But also United Way, Bay County, and Bay Area Community Foundation. Lots of service.
Great work. Glad you guys are working together. Nice to have you in tonight, as usual. And that's our show for tonight. Be sure to join us again next Tuesday night for the follow-up right here. State lawmakers are hiking the price of cannabis to pay for road repairs. What's the impact on the growing marijuana business here in mid-Michigan? That's next week right here on the follow-up. Thanks for joining us tonight. Have a great night. We'll see you next Tuesday night.
Thanks for watching. If you enjoyed this video, please like, share, and subscribe. And make sure to click that bell icon to stay notified when we upload new content. Videos like this are only possible because of viewers like you. To help support this channel, click on the link in the description below. We'll see you next time.